Ectopic pregnancy. Ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants somewhere other than the main cavity of the uterus. Pregnancy begins with the fertilized egg. Normally, the fertilized egg attached itself to the lining of the uterus. An ectopic pregnancy most often occurs in one of the tubes that carry eggs from the ovaries to the uterus. Fallopian tubes. This type of ectopic pregnancy is known as a tubal pregnancy. In some cases, however, an ectopic pregnancy occurs in the abdominal cavity, ovary or neck of the uterus cervix. An ectopic pregnancy can't proceed normally. The fertilized egg can't survive and the growing tissue might destroy various maternal structures. Left untreated, life-threatening blood loss is possible. Fallopian tubes containing a large ectopic pregnancy. As the pregnancy grows bigger, the tube will burst. Fallopian tube containing a small ectopic pregnancy. Symptoms. At first, an ectopic pregnancy might not cause any signs or symptoms. In other cases, early signs and symptoms of an ectopic pregnancy might be the same as those of any pregnancy: a missed period, breast tenderness, and nausea. Light vaginal bleeding with abdominal or pelvic pain is often the first warning sign of an ectopic pregnancy. If blood leaks from the fallopian tube, it's also possible to feel shoulder pain or an urge to have a bowel movement, depending on where the blood pools or which nerves are irritated. If the fallopian tubes reports heavy bleeding inside the abdomen is likely, followed by lightheadedness, fainting and shock. Causes. A tubal pregnancy, the most common type of ectopic pregnancy, happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by inflammation or is misshapen. Hormonal imbalances or abnormal development of the fertilized egg also might play a role. Complication. When you have an ectopic pregnancy, the stakes are high. Without treatment, a ruptured fallopian tube could lead to life-threatening bleeding. Tests and diagnosis. If your doctor suspects an ectopic pregnancy, he or she might do a pelvic exam to check for pain, tenderness, or a mass in the fallopian tube or ovary. A physical exam alone usually is not enough to diagnose an ectopic pregnancy. However, the diagnosis is typically confirmed with blood tests and imaging studies such as an ultrasound. With the standard ultrasound, high-frequency sound waves are directed at the tissues in the abdominal area. During early pregnancy, however, the uterus and fallopian tubes are closer to the vagina than to the abdominal surface. The ultrasound will likely be done using a wand-like device placed in your vagina. Transvaginal ultrasound. Treatments and drugs. A fertilized egg can't develop normally outside the uterus. To prevent life-threatening complications, the ectopic tissue needs to be removed. If the ectopic pregnancy is detected early, an injection of the drug methotrexate is sometimes used to stop cell growth and dissolve existing cells. It's imperative that the diagnosis of ectopic pregnancy is certain before this treatment is undertaken. After the injection, your doctor will monitor your blood for the pregnancy hormone human chorionic gonadotropin (HCG). If the HCG level remains high, you might need another injection of methotrexate. In other cases, ectopic pregnancy is usually treated with laparoscopic surgery. In this procedure, a small incision is made in the abdomen, near or in the navel. Then your doctor uses a thin tube equipped with a camera, lens and light to view the area. Other instruments can be inserted into the tube or through other small incisions to remove the ectopic tissues and repair the fallopian tube. If the fallopian tube is significantly damaged, it might need to be removed. If the ectopic pregnancy is causing heavy bleeding or the fallopian tube has ruptured, you might need emergency surgery through an abdominal incision. In some cases, the fallopian tube can be repaired. Typically, however, a ruptured tube must be removed. Prevention. You can't prevent an ectopic pregnancy, but you can decrease certain risk factors. For example, limit your numbers of sexual partners and use a condom when you have sex to help prevent sexually transmitted infections and reduce the risk of pelvic inflammatory disease. Quitting smoking before you attempt to get pregnant may also reduce risk factors. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you.